Sports-related injuries. You ever had a painful injury due to sports or some sort of sporting activity? If so, you're not alone. According to Johns Hopkins medical researchers, around 8.6 million injuries occur each year in some sort of sporting activity, whether that's a concussion, a tear, a pulled muscle, anything like that. And unfortunately, around 3.5 million of these people are children aged 14 and under that are involved in some sort of youth league sport. First thing we're going to discuss are common tendon ligament injuries that are seen in almost every athlete that play the game today. The first one we're going to talk about is the ACL. And on average, around 200,000 people tear their ACLs every year involved in some sort of sport. And it is located in your knee. It is behind the front of the PCL and behind your MCL and also beside your PCL. It's caused by constant cutting or excessive use. Most of the time, 9 times out of 10, it's going to be caused if your muscle isn't strong enough to support your knee or the ligaments inside of your knee. And there's a picture of where it's located at in your knee. You can expect recovery time from this to be anywhere from 6 to 8 months, depending on how severe it is and what kind of surgery you have and everything like that. Next one we're going to talk about is the posterior tibial tendon, or the PTT. And according to sportsinjury.org, it is one of the most common foot and ankle injuries among athletes that involves a tendon, some sort of tendon. And tendon is located at the back of the leg and passes underneath your ankle, and it attaches onto a bone in the arch of your foot called the navicular bone. And it allows you to do basic movements such as pick yourself up on your toes and everything like that. It can be torn or damaged if you overuse a tendon. There's not much you can do to actually tear the tendon itself in one accident, but 9 times out of 10 it's going to be caused by wear and tear or just constant motion that isn't supposed to be there on that tendon. There's a picture of where it's supposed to be. And if you do have surgery to fix this, you can expect recovery to be anywhere from 4 to 12 months. The third and final one we're going to talk about is the Achilles tendon. It occurs in about 230,000 athletes each year, according to sportsorthopedics.org. It allows you to do basic movements in your foot, such as push off while you're walking, running, jumping, anything like that. It's located in the back of your leg. It attaches several of your calf muscles onto your heel. And it is the strongest tendon in your body. Although it's the strongest tendon in your body, it can still be torn or damaged in some sort of way. And if it does get partially torn or completely torn, then you will not be able to walk or even move up on your toes, for that matter. There's a picture showing where it's at. And it is very painful if you do tear this or some sort, so many doctors will advise immediate surgery to fix it, and you can expect recovery time to be anywhere from 4 to 12 months if this happens to you. Now that we've identified several ligament and tendon injuries that can occur to you, now we're going to talk about strains and sprains. And they are the most common injury that happens to athletes. There's a graph showing that, and if you notice, fractures, which is in second place in this graph, is barely half of that. Sprains. Sprain is a ligament injury resulting from twisting a joint or wrenching on a joint in a way it's not supposed to be wrenched on. Ankle sprains are the most common injury in the U.S. among athletes. And, self-treatable injury and resolves within a few weeks to a few days. And when sprains happen, it's normally because your joint moves in an unnatural way, resulting in the ligament getting stretched or pulled. So 9 times out of 10, the doctor's just going to send you to some sort of rehab center and you'll be good to go in a couple weeks. And that's just a picture showing how you can sprain your ankle. Next, we're going to discuss a strain, which is an injury to the muscle of a tendon. It's often caused by overuse, force, or stretching in any sort of way, such as the wrong type of force applied to whatever tendon or muscle that might be. Common strain that is seen a lot is a hamstring strain, and unfortunately these are very painful, but these can be prevented because if you properly stretch or warm up before any type of exercise, then you'll be fine. More likely if you don't warm up before exercising yet, or if you overload the muscle, that's also a great way to get some sort of strain in that muscle. Injury prevention. So far we have discussed common injuries in athletes, so now we're going to touch on injury prevention. But fortunately, anyone can do this. But first, we're going to talk about strength training. It is the easiest way to prevent any sort of injury related to a tendon or a ligament. It makes them stronger. A common form of injury prevention is strength training. It can include any sort of working out with weights or any sort of resistance band work that you can think of. Resistant bands are good for ligament movement because they can target each individual ligament or tendon that you need to work. Squats, lunges, leg press, etc. are all great workouts to do as long as you do them with proper form. If you do them with improper form, then you could further injure yourself. That's a picture showing somebody doing work with a resistance band. Strains and sprains for benching. Avoiding exercising or playing sports when tired or in pain. That basically means whenever you feel that muscle or ligament start getting tired, then you need to stop, or else it could result in a serious injury. Eating a well-balanced diet to keep muscles going, keep muscles strong, and believe it or not, that is very important because the stronger your muscles, the less likely you are to hurt something. Maintaining a healthy weight. Obviously, if you're overweight, you're more at risk of hurting yourself in any sort of way. Trying to avoid falling, especially if you're unathletic. The wrong type of fall could do some serious damage. And wearing shoes that don't fit well. This goes along with any sort of thing you're wearing whenever it comes to any type of sport, any of your equipment. If it doesn't fit right, you're risking getting hurt. And that all starts with your shoes. If you're wearing a shoe that's too big or too small, if it's too big, your foot can constantly slide around, and everywhere from your foot on up is going to constantly be sliding around. It's going to cause a lot of unnecessary grinding and rubbing in your foot and your knee and everything up on there. So, in conclusion, injuries are far too common for athletes and can be easily prevented. Just be sure to stay healthy and maintain a proper weight, and keep all of your muscles and ligaments strong. And that's it. Thank you.